everyone, welcome to the MOOC lecture series, an initiative taken by LJ Institute of Pharmacy. Myself, Tosha Pandya, Assistant Professor, Department of Pharmaceutical Technology, will be taking the session on monophasic liquid dosage forms. So in the previous session, we have seen about the introduction of the liquid dosage form, in which we have seen that the liquid dosage forms are of two types, monophasic and the polyphasic. So today in this session, we will discuss about the monophasic dosage form. So what are monophasic dosage form? As the name suggests, monophase means it is just a single phase. So it is a liquid preparation containing two or more components in a single phase. Okay, so it is represented by the true solution, that is, it is a clear homogeneous solution having solute dissolved in the solvent. Okay, so this is the classification of the liquid dosage form. You can monophasic liquid dosage form, you can see you have the liquids which are for internal application, internal use, like which are to be consumed, like the syrup, elixirs, linctus, etc. Okay, and then you have the liquid dosage form for external application. Now externally they can be applied into different body cavities, like they can be taken in the mouth. Okay, they can be for external application in the mouth, like the gargles, mouthwash, paints, etc. They can be for skin, like the lotions, okay, liniments, paints, etc. And they can be for body cavity, like the eye drops, ear drops, okay, nasal drops, enemas, etc. So now first let us see the liquids for internal application. In that you have the syrups. So what are syrups? So syrups are the aqueous preparations which contain about 60 to 85% of sucrose with or without the flavoring agents and along with the medicinal substance. As you all know, syrups are mainly consumed for cough, cold, etc. Okay, so in that you have example like chlorpheniramine maleate syrup, chlorhydrate syrup. Next, for internal application are the elixirs. So what is difference in the elixirs? So elixirs are mainly, they are sweetened hydroalcoholic solutions with or without medicinal substance. They are intended for oral use. Okay, so you have alcohol which is there in the elixirs. Example are dexamethasone elixirs. So the alcohol has dual effect. It will give you the soothing effect, relaxing effect along with the preservative action. So next is the linctus. So linctus are mainly viscous liquid preparation which are mainly for relief in the cough. Okay, example is the codeine linctus. Now these are some of the marketed preparation. As you can see, you have the syrup, okay, which is there. You have elixirs and the codeine linctus which are already in the market. Next we'll see the preparations for external administration orally. Okay, so first is the gargles. As you all know, this gargling effect you have already taken with warm water and salt, you do the gargles. So the gargles are already available in the market. These are aqueous preparations which contain antiseptics or antibiotics, mainly for throat infection. It is to be gargled like you gargle warm water with the salt. Okay, so you have the specific labeling instruction for gargles, that is dilute with warm water before use. Example is the povidone iodine gargle. Mainly if you have any dental cavity removal or any dental infection you have gone through, this gargle is preferred. Next is the mouthwash. So normally whenever you go for traveling, you forget your brush, okay, or the toothpaste, you carry mouthwash which is easier for cleansing purpose or for deodorizing your buccal cavity. Okay, so it is aqueous solution with the pleasant taste and odor. Mainly the antiseptic phenol derivatives are the used. Next is the throat paint. Now this throat paint is the viscous liquid preparations used for mouth and throat infections, like the phenol glycerin or the compound iodine throat paint. Now whenever you have iodine use, specific labeling instruction should be there. It should be in the amber color bottle, and in the it should be stored in the dark place because iodine is sensitive to light. So next, these are the marketed products, as you can see, available as the gargles, as the mouthwash, and as the throat paint. Next are the external administration in the body cavity. So in the first you have the eye drops. Now eye drops, whenever you have taken, it should be sterile. It may be aqueous or oily preparations intended for installation in the eye, like the timolol malate eye drops. Now specific labeling instruction for the eye drop should be there, that you, whenever you find any visible particles, then it should not be used, and if the cap is open, then it should not be used for the installation, because it may lead to irritation effect. Next is the nasal drops, which are mainly used for nasal congestion in the upper respiratory tract, like the oxymetazoline hydrochloride nasal drops. Next are the enemas. So these enemas are mainly taken for rectum and colon via the anus for cleansing purpose. It may be for therapeutic use or it may be for diagnostic purpose. These are some of the marketed preparation of the preparation intended for the body cavity. Now liquids for external administration on the skin. So many liquids you are preferred on the skin, like the liniments, which are oily liquid preparations intended for external application with rubbing action to the affected area. They are mainly used for relief in the pain and stiffness, such as from muscle spasm and arthritis. Next are the lotions, as which you very well use. It has low to medium viscosity, mainly used for moisturizing purpose, like the calamine lotion and the baby lotion. Paints mainly used to sterilize the skin, like the betadine antiseptic paint and the magenta paint. So these are some of the marketed products of the preparations used for external application in the skin. Now some of the formulation consideration for the monophasic dosage form is the solubility. As we have seen that monophasic dosage form should be in one phase, so solubility is a very important criteria, then stability and the preservatives. And for the pharmaceutical elegance, the care should be taken for the viscosity modifiers should be added, sweetening agents, flavoring agents, and the coloring agents. So, manufacturing consideration for the raw materials, equipments, and the manufacturing procedure. So, I hope you are clear with the monophasic dosage form. Do like, share, and subscribe our YouTube channel Pharma Ignite, and press the bell icon for regular notifications. Thank you.
Please do like, share, and subscribe our YouTube channel Pharma Ignite, and do not forget to press the bell icon to get the regular notifications so that you do not miss out any of the topics in this chapter. Thank you.